Good afternoon. I hope everyone had a nice weekend and happy Mother's Day, and to all mothers. This week, during National Nurses Week, we celebrate the compassionate, hardworking nurses across the country and across our province. Especially during these uncertain times, we're fortunate to have so many wonderful nurses working in a variety of settings here in Prince Edward Island, and thank you so much. And wonderful nurse beside me. Around the world, there are now more than 4 million cases of COVID-19 and more than 280,000 deaths. Across Canada, there are almost 69,000 cases and more than 4,800 deaths, putting our case fatality rate at 7.1%. PI still has a total of 27 cases, all of which are now considered recovered. There's no evidence of active COVID-19 community transmission in PI. We continue to test, having 255 new negative tests over the weekend. Of course, over the weekend, on Friday, we eased some of the public health restrictions, and I know it was welcome news for many, especially as we celebrated Mother's Day. As we are still receiving some questions, I want to again clarify the more recent changes. Members of the same household can gather indoors with up to 5 other individuals from other households. And these gatherings apply to personal gatherings among individuals and not businesses. It is very important that we continue to maintain physical distancing as much as possible. The other part that we talked about on Friday is that Islanders are now able to extend your household to reconnect with a loved one or support person. And this may be 1 or 2 people that you may choose to be closer with. And these are people who are you choose to be part of your family unit, where you would maybe have daily interactions, daily life support, whether it's emotional or physical, with your household. It's important to continue to protect your household, your supports, and your loved ones. So if you choose to extend your household, consider those risks and do so only with individuals you feel or need to be closer to or support your household. We've been asked questions about children having sleepovers now that the measures are being relaxed. And sleepovers are not currently recommended outside of your own household or perhaps the extension of your household to 1 or 2 key people. So for instance, if my sister is being considered part of my sort of extended household at this point because she helps with the care of the children, my children could stay over at her house. But other than that, in general, sleepovers would not be recommended. But during this phase, outdoor and indoor play dates may be planned with physical distancing and following the gathering limits. So it's important to remember that no toys or equipment should be shared during this time. As someone said, and I'll continue to mention this, we've done so much, and it would be really unfortunate if we go too quickly without caution and we impact our whole summer because we've gone too quickly. We've also had some questions about how do you maintain physical distancing when gathering indoors, and I recognize that in many cases this will be difficult, which is why we ask you to do as much as possible trying to keep 6 feet, that 2-meter distance. Sharing objects is discouraged, and it's important that food isn't shared. So if you have a bowl of popcorn to share while you have a friend over to watch a movie, you're sitting far a good distance apart, but you don't keep reaching in and out of the same popcorn bowl. And if you're serving food, it should not be a buffet style. As always, it's extremely important that you do not visit anyone if you're feeling ill. And if you need to cough or sneeze, do so into your sleeve, wash your hands, and frequent hand washing continues to be extremely important. While COVID-19 can make anyone sick, people who are older and have underlying medical conditions are more at risk of developing severe complications. And high-risk individuals may want to keep even more stringent measures in place to continue to feel safe. I ask all Islanders to keep this in mind and to be as kind and understanding as possible. And if you're not sure of someone's comfort level, it's important that you ask. Make sure you leave adequate space between you and others when shopping or out in public. Offer to pick up essentials for someone in your life who is at high risk. Although many people are very excited about these new, the relaxation of public health measures, please be aware that it is still a very scary time for others. And for all of us, we need to be careful, and we want to make sure everyone is well supported. It's also, I'd like to note how difficult life is for those with mobility issues and visual impairment issues, especially with COVID-19 situations and the measures in place and the changes that are being put in place. So whether it's with new ways of lining up or spacing out and sometimes physical barriers, it reminds us all to be supportive of those with mobility issues and visual impairment. And that's individually and well as businesses to remember. I hope this weekend was a good opportunity for Islanders to visit with those they have missed so much over the last number of weeks. I know my mother came to our house for the first time. I hope we will, and she said, and I've heard from others, I hope we'll all learn and take the best of what we've been through in the last weeks, that we do appreciate and be grateful, and we've talked about gratefulness here before, but grateful for each other and the time together. I also had notes from a class of grade 3 and 4 children, and they wrote about the things that they've been doing over the last number of weeks. And they are playing cards, spending time with their family, spending more time outdoors. And for all of us, it has been a reminder of these important fundamental aspects of our lives. And it outlines for me certainly how we go forward and in our time together, be kind and spend time, and whether that time together is spent virtually or in person, how important that is. And let's look after each other as we go forward together. Be patient, and we'll continue to be patient and look after each other as we go forward. Thank you. Quelques mots en français. Je vais juste faire assez vite. En français. Cette semaine, nous fêtons la compassion et l'implication de tous les infirmiers et les infirmières à travers le pays et à notre province. On est bien chanceux d'avoir autant de personnes dévouées à cette vocation aux divers endroits de travail. Merci à vous tous. Il n'y a aucun cas à l'île du Prince-Édouard et c'est une excellente nouvelle pour nous. Il n'y a toujours pas d'indication d'infection communautaire, transmission à l'île du Prince-Édouard non plus. On a accéléré certaines mesures de déconfinement vendredi passé et c'était une excellente nouvelle pour la fête des mères. Je sais que nous changeons les consignes souvent, donc je voudrais clarifier certains points. Pour les rassemblements à l'intérieur, ce sont les personnes qui habitent la maison présentement et vous pouvez recevoir un maximum de 5 autres personnes. Mais il faut toujours pratiquer la distance physique. Je sais que le temps que vous étiez séparés de vos proches était très difficile et que vous voudriez les serrer. Et vous pouvez maintenant élargir votre famille d'une ou deux personnes et vous pouvez les serrer parce qu'elles font partie de votre famille principale maintenant. Je vous demande juste de bien y songer avant de choisir ces personnes. Considérez votre maison, vos appuis, vos proches. Nous ne voulons mettre personne à risque. Soyez sélectifs et négligez pas le risque. Et la COVID-19 peut toucher la vie à n'importe qui, mais surtout les populations vulnérables comme les personnes âgées. Et si vous êtes une personne à risque, considérez quelques mesures que vous devriez garder en place pour votre bien-être. S'il vous plaît, n'oubliez pas ceci et restons compréhensifs les uns vers les autres. Finalement, j'espère que le week-end vous a offert la chance de voir plus de personnes, d'en serrer quelques-uns. Ne lâchons pas ce que nous faisons, on va continuer de protéger les uns et les autres. On va continuer notre plan de déconfinement tranquillement, petit à petit et avec beaucoup d'attention. Merci à tous les insulaires pour les efforts ardus. Merci.
Thank you. Good afternoon, everyone. The Joint Response Team is carefully monitoring the COVID-19 situation on PEI, and we continue to monitor the health services that are delivered, especially as more services, such as some elective surgeries, are happening now in hospitals across the province. A services reinstatement team will take over coordinating the reestablishment of some services and will be working through longer-term efforts to increase services to Islanders in healthcare. This team is a mix of clinicians and healthcare leaders who will consider the needs of patients and weigh any risks of reintroducing services against the risks of not introducing them. It's important for patients to know that anyone who is going to be rebooked for a procedure or an appointment will be contacted by Health PEI or your healthcare provider, and there's no need for you to call to rebook. Our hospitals and healthcare facilities are safe. If you need care, feel confident that each facility is following our infection prevention and control protocols to ensure your safety. I want to remind Islanders that we have many mental health and addiction support services available. Last week, we started the Child and Youth Urgent Mental Health Care Service, which is now available for children and youth under the age of 18 with urgent and acute mental health needs. There's a toll-free number to access this child and youth mental health clinic, and it's 1-866-833-5443. And the hours are from 12 p.m. to 6 p.m. daily. Trained mental health clinicians with Health PEI will provide a thorough risk assessment, stabilization, and connect children and youth to local community supports. Clinical psychologists, crisis nurses, and social workers are available as part of a multidisciplinary team to support this child and youth urgent mental health care service. Psychiatrists are also available on call or via telehealth if needed. Adults can also access information on mental health and addiction services through the COVID response line, and that's the number in front of me here, the 1-833-533-9333. Calls will be answered there as well by trained mental health and addiction staff from 8 to 4, Monday to Friday, and they will help Islanders reach the support that they are needing. Individuals who have an acute mental health issue will be directed to psychiatric urgent care clinics or the emergency departments as usual. Our cough and fever clinics continue, and the drive-through testing clinics in Charlottetown and Summerside. Over the weekend, we saw 58 patients at our Charlottetown clinic and 32 in Summerside. Just a reminder that anyone who has symptoms of a new cough, fever, sore throat, runny nose, or unexplained fatigue, to please contact your family doctor or nurse practitioner or call 811 to arrange an appointment at our cough and fever clinic. I want to also acknowledge that this is National Nursing Week, and normally this week we have lots of celebrations in the public and some specific awards across the province for, in particular, some of our frontline nursing staff. Those things won't be happening this year, but I would like to take a moment just to acknowledge the knowledge and commitment and dedication and hard work of those in the nursing profession across PEI. This year, the theme is A Voice to Lead, Nursing the World to Health, which is fitting when we recognize the importance of our nurses as we face this global pandemic together. It's a particularly special year to celebrate nursing, as the World Health Organization has designated 2020 as the International Year of the Nurse and Midwife. It's in honor of the 200th anniversary of Florence Nightingale's birth, which happens tomorrow. Nightingale was a visionary nurse and leader and the pioneer for modern nursing. She also had a particular interest in infection prevention and control, and leading to many improvements in patient outcomes related to disease or those other things besides the initial treatment which may have contributed to their poor health. Today, we see the spirit of Florence Nightingale in many of our nurses who work tirelessly to provide excellent service, change and improve the health system through public health measures, education, innovation, and leadership. To all the nurses and nurse practitioners who work in varied roles across the province in all avenues of our healthcare system, thank you. Take some time to recognize one another this week and also receive the recognition for the contribution you make in your work. Thank you.
Thank you, Marion. And we'll open it up for questions.
Carrie Campbell, CBC.
Good afternoon, Dr. Morrison. I just wonder, with the easing of some of the restrictions over the weekend, if there was anything you had to report with regards to enforcement efforts or any concerns, whether Islanders are maintaining the required physical distancing as we further ease some of these restrictions.
Hi, Carrie. I think we had a couple of concerns raised about the physical distancing, and I think that's why I tried to emphasize it today, that it is going to be part of how we, work and socialize and go into businesses as we go forward. So that physical distancing being important, an important component as in the weeks ahead. So I'd like to remind everyone about that importance. Along with making sure you're not going out if you are feeling unwell. I do have, as of this afternoon, we have had, from an enforcement point of view, 102 warnings issued, 16 charges, and over, trying to add this up in my head, but over 250 complaints through a variety of means, whether that's through to our office or Crime Stoppers or police directly.
Okay, and I just wonder, on the other side of this, with businesses and their reopening, I wonder just how many complaints you're hearing about maybe possible risks within those businesses, or if you're hearing from the businesses themselves about difficulties that they're having as they try to move forward and minimize the risk.
So I think from the business point of view, there are a number of them working on their operational plans. So taking into consideration some of those aspects that we've talked about here before. We've also certainly heard from some organizations around measures that they are giving guidance for their members, and it's been amazing that there have been so many great, innovative ways of approaching how businesses will try to maintain physical distancing, what they'll be doing for screening of individuals and employees and staff to make sure that if they're sick, they're not coming into work, and what they're going to do for enhanced cleaning. And so I think everyone's thinking about it. I mean, we should be thinking about that in our own, wherever we work, and even in our own homes if we're having people over as part of this increasing our contacts. So we have been having questions from whether it's individual businesses or they're submitting from a sort of an organization or association point of view some guidance. So it's been actually more questions and wanting to make sure that they're considering all the right measures as opposed to really complaints at this point in time. I think they're wanting to keep the public safe in their businesses, they're wanting to keep their staff safe in their businesses, and they're trying to figure out the best way to do it. And it varies very much between business, what kind of services they're offering. And so we'll continue to work, as we've talked about before, Carrie. We have a 1-800 number, we have an email address, and we're certainly trying to get back to people as quickly as possible about some of those plans that they've had. We've also been trying to put out some general guidance that is important, and we put up some more guidance documents over the weekend, so hoping to help workplaces, for instance.
Louise Martin, CBC. Hi, good afternoon. Happy belated Mother's Day to both of you. Happy Nursing Week, Marion Dowling. Dr. Morrison, you said on Friday that there's always a potential for more cases on PEI. There could be, a second wave. What does that do to the modeling numbers you released a month ago, and will you be updating those? Does it make sense to update those modeling numbers that you put out, I think it was April 14th?
Thank you for that. We actually, of course, that's one of the issues with modeling. It changes with the different inputs that you put in place. So we actually have done some last week, which may need to have some even modifications with every day. It can change, but some of those modeling assumptions and numbers that I think we anticipate even putting up on the website sometime this week. Of course, it is one tool that we look at, and that what we're referring to is really what a second wave when it might happen, what it might look like. But it's very dependent on how much contact we increase, and if we do that too quickly, and also the border restrictions and our risk of importation. So I think that's why models are always a challenge for not just us, but right across the country, but maybe even more for us because we are having to make certain assumptions without having cases or hospitalizations or people in critical care beds at this point in time.
All right, I appreciate that. My follow-up is regarding testing. I know right now we're doing, I think Dr. German told me last week, about 100 tests per day, so around 700 per week. And I know we've said the capacity is up to 2,000 tests per week. So when will we be sort of ramping up to that 2,000 tests per week or even more? And who would be tested under that broader testing? Are we focusing on any more specific areas? I know we've talked about essential workers like truck drivers. I'm thinking long-term care homes and healthcare workers. But could it be expand beyond that to other essential workers, say at grocery store or drugstore, anything like that?
So great question. So we are trying to, we know we have the capacity, and we're trying to focus our testing on certainly some of the potential higher risk groups. And we have probably the broadest testing criteria right now in the country because we're testing, looking at testing asymptomatic people as well. So we're actually, even this morning, trying to make sure we roll out for essential workers coming back and forth into our province, because those essential workers who are having movement in and out of on a regular basis, not just the truckers, but we already are doing healthcare workers, but moving beyond that, the numbers of healthcare of essential workers coming in and out of the province is substantial. So probably a few hundred a week that we would like to add to that regular testing. So not just testing them once, but on a routine basis as they come in and out. And so that would be one priority area that we're really trying to focus on. We've talked about the people being admitted even without symptoms prior to admission at long-term care. We're talking about any healthcare workers going back and forth even without symptoms if they are having to move between facilities. So we're going to continue to look at what we can do and where it makes sense. We shouldn't be testing absolutely everyone when there's no evidence to suggest that's where we should focus, but we are continuously looking at that on a weekly basis, and we are wanting to do more testing, certainly not less, so it will continue to be important. So I'm hoping that we can increase that number and but make it there's no point increasing that number and not test the people who are the most at risk. We should focus on those first.
Thank you very much.
Hi, good afternoon to both of you. First question for Ms. Dowling. I wonder if you could give an update on the shipment of ventilators that I think we were talking about last month. I think the island was expecting 20 total order, 27 through federal and provincial purchasing. So I'm wondering if those have all been received and whether there have been any additional ventilators that have come from the National Emergency Strategic Stockpile.
Hi. Yes, we've received 10 from the National Emergency Strategic Stockpile. We have not received any others from the federal government bulk purchase request or from the stockpile to this point. We also were talking with our vendor last week about the estimated delivery date because we had expected those, or we do expect those, sort of toward the middle of this month. And they did not yet have a confirmed date for us, but we have not received those, and that was 12, I believe is the number. I don't have that right in front of me, Stu, but I think it was 12 that we had ordered directly from our vendor. So we're still anticipating those arriving this month, but we haven't got a confirmed date for those yet. So the only additional ones that we've received are the 10 through the National Emergency Strategic Stockpile, in addition to, of course, the 19 that we have on PEI.
Okay, thank you for that. I guess second question for Dr. Morrison. I guess Premier King has sort of mused about the hope for, I guess, what's been referred to as, I guess, a bubbling between New Brunswick and Prince Edward Island, which I assume would mean that some of the 14-day quarantine restrictions would be eased between the two provinces. I guess what I'm wondering is, from your standpoint, what would need to happen before something like that was put in place, both in New Brunswick and PEI?
Well, as you mentioned, Stu, I think the Premier's mused about it, and I know my counterpart, Dr. Russell, and I have also mused about it as well. I think the time is going to, I don't think we're ready to do that now, but it will be, so the biggest factor will be time to see what happens as we start to ease up some of our own measures within New Brunswick and within Prince Edward Island. New Brunswick keeping certainly very interprovincial restrictions very strongly in place at this point in time. As we are, but looking to see what is happening over the next few weeks. But definitely still a consideration for sure. I just thought I might pick up, Stu, on the ventilator question, just for interest, that out of the cases that we talk about in this country, 16% of them are hospitalized or have been hospitalized to date. 3.4% of those hospitalizations have ended up in the ICU, or close to that, so over 3% hospitalized. And then I believe it's around 1.5% of those in the ICU are actually ventilated, or on a ventilator. So I just thought that might be additional information for you.
Okay, thank you very much.
Good afternoon to you both. I have a question for you, Ms. Dowling. I have heard that some space is there are movements in long-term care to free some spaces for people who would be hospitalized because of COVID. And I heard that, especially at the Somerset Manor. I'd like, can you confirm that, please?
Hi. Actually, the space we're trying to create within long-term care homes would not be for anyone who would require hospitalization for COVID. It is specifically being planned to accommodate some designated space for any individuals who are currently living in long-term care homes who would require some segregation from the remainder of the long-term care home population. So in order to prevent any spread of that illness. But if any of those individuals required hospitalizations, our plan is still very much for them to go to the hospitals for care.
And so just to follow up on that, what would be the movements between the long-term care home facilities?
What we're currently considering is moving residents that live within the home to another area of that same home, so with the same staff, in order to create a designated space that would be separate and apart from the rest of the residents, and to have that available should there be any positive cases within any of our long-term care homes.
Thank you.
Be moving within the home they're currently living in.
Okay. Thank you.
Good afternoon to you both. Question en français pour vous, Dr. Morrison. Vous avez parlé un peu plus tôt en anglais de l'innovation qu'on voit chez certains commerçants dans les préparatifs pour rouvrir leurs portes dans quelques semaines. Pourriez-vous peut-être expliquer un peu en français qu'est-ce que vous voyez qui rend ces commerçants aussi innovants au moment où on doit chercher des solutions un peu différentes pour être capable de repartir en affaires?
Bonjour. On voit et puis avec leur plan des innovations qui sont différents que leur façon normale de fonctionner. Ils pensent déjà comment avoir des limites, le nombre de personnes qui entrent au business, comment ils vont séparer pour garder la distance physique. Ils discutent les barrières pour diminuer un risque. Ils pensent comment ils vont faire laver les mains plus souvent avec les employés et avec les membres de la public. Toutes sortes de choses que il y a quelques mois, ils n'ont jamais pensé vraiment. Et puis, je suis un peu surpris, mais content en même temps qu'ils pensent de toutes les manières pour en faire, pour protéger leurs employés et la public.
Sur un sujet un peu différent, Dr. Morrison, la semaine dernière, vous avez fait une alerte au sujet de surdose de fentanyl dans la province. Est-ce qu'il y a du nouveau par rapport à ça? Est-ce qu'il y a eu d'autres surdoses? Est-ce que vous avez réussi à identifier peut-être la source de cette drogue?
Merci. J'ai pas de nouvelles à propos d'une source. Et puis, j'étais en call pendant le week-end. Et puis, je n'ai pas eu les nouvelles jusqu'à ce matin d'autres surdoses. Mais on va continuer comme avant de surveiller. Et puis, si on va voir d'autres.
Merci beaucoup.
Merci. I'll just translate that last question because the first one I answered in English. The second one was about any updates on the fentanyl overdose situation. And as of this morning, I am not aware of other fentanyl-related overdoses over the weekend, but we will continue to monitor and as we did before and be paying close attention to that. So thank you very much, and we'll see you on Wednesday.